Hello and welcome to another episode of Quarantine with Fulbrighters, and it is a privilege and an honor to have Dr. Mekaiel Zia, who is working on the front lines, so can tell us more about the thing that is on all of our minds. Dr. Mekaiel Zia has a master's in public health from Emory University. Hi, Mekaiel, how are you doing?
Hi, I'm good, considering the circumstances, but thank you for having me.
That's my answer always as well. As good as one can be in these circumstances, you realize that people have it much worse, but you're actually on the front line, so you see it every single day.
So yes and no. I say that as for two reasons. Yes, I'm on the front lines, but there are people who are still further ahead of me on the front line. So I think that
You're the
I
one
need to
sending them there.
Unfortunately, but it needs to be done. Given the hour and given um, the running joke that we have is that we're working on war footing at this point.
Yes.
So given that this is war footing, I sometimes feel I am, the general sending out the troops. It's like.
So just to give people context, you're currently working at the Shifa Hospital COVID ward.
Not really. I'm part of the management team. I'm looking after several different areas. However, given the current situation, we've all sort of expanded our roles and really taken on areas that we can help with at this point. I have a public health degree, so I'm working as a public health liaison for my organization, in addition to my usual duties. So that's what the breakup is. For us, I think given the fact that it is a pandemic, we realize that there's no limitation of it just being a COVID ward or a COVID clinic. We realize that this is an overarching situation where anybody walking in, including our staff or patients, the community, could be positive. And so for us, it's kind of lumped in. So I want to make that differentiation.
All hands on deck.
Absolutely.
So where do you think we stand as a country in terms of dealing with it, specifically to do with where our hospitals are at this point?
To be honest, I think we've come a long way. I would like to say that first and foremost, because I know that given that we're in a lower middle income country, and given that our healthcare sector has been, one of the most struggling portions of, our economy, and given that if you look at any large scale healthcare indices, we really lag behind. So given all of these things and the fact that we have some of the lowest GDP spending per capita on, healthcare, and I'm not saying that just as a criticism of a particular government, this is a long-term trend. And given all of these things, lack of resources, training, a lot of these things, I think we were really, really unprepared for the whole pandemic. This is not just a personal opinion. I know that everybody in the healthcare sector realizes this. We feel this, and we kind of had to really take a very hard look at ourselves and be like, okay, this is a situation. We kind of have to now deal with it. We are, we kind of have to make do with what we have and improve upon our systems, upon ourselves as quickly as we can. And I think in that sense, I would not want to comment on where we stand as a relative to, for instance, compared to another country, but compared to ourselves, which is, I guess, the best comparison, we have really started to take it seriously. And I think we are really at a point where a lot of organizations, a lot of private, public entities, both of them combined, have realized that they have to step up, their game in order for us to really sort of be able to make a dent in the current situation. So I think, it's going to be difficult. It's an uphill task, but I think if I compare what I know about, one healthcare system or just Islamabad in general or Pakistan in general, or the overall sort of attitude towards the disease, and pandemic preparedness, because again, pandemic preparedness and public health is its own thing. It's its own domain. And so, and disaster, when I say pandemic preparedness, is disaster preparedness, disaster management. And so I think in that sense, I've had people come up and tell me, and I'm not going to name who this person is, but they told me that I used to think that you public health professionals, all you like to do is lecture us, कि ये नहीं ठीक है, वो नहीं ठीक है, ये करना चाहिए, वो करना चाहिए. And for once, we think you were like, I stand corrected, and I think that, you were right, and we should have started off as a country, and just, in the context that they were speaking of, was that we should have started off on this much, much sooner. So I think there's a realization, but I think there's a long way to go, because if we look at the way that, the numbers that we have, because one of the biggest limiting factors, and I know this is continually discussed everywhere, if you look at, for instance, because I've been following the situation in New York, we've been in touch with, the healthcare systems there. I have been in touch with, some of the hospitals in Wuhan, their healthcare systems, the Chinese authorities. You do, as professionals, check base and see, okay, what are you guys doing? XYZ is doing this. How can we do better? Do you have any tips? Do you have any pointers? This is how we're thinking of handling this situation. Do you have any inputs? And so in that sense, you kind of realize that, one of the things everybody wants to talk about is screening, is about, the number of ventilators you have, stockpiles. And I agree, all of those things are really, really important. But I think one of the things that no one really talks about and really doesn't maybe get it across is that these things are really important. But what's really important, even more important rather, is that you need to have healthcare professionals behind these, working these machines, taking care of the actual people. And if you look at Pakistan and look at the rates of our infected healthcare workers who've been infected in comparison to other countries, you realize that our healthcare teams, our healthcare workers, our healthcare professionals, they've really been hardest hit so far. And given this small amount of resources we already have, I think we need to count them as a resource also, because I think that is sort of like, we can't just take that as, collateral damage, for this pandemic. We have to sort of like keep them as reserve. We have to, take care of them, because they're the ones who are taking care of all of us at the end of the day. I mean, I'll give you a prime example, is that, I have a degree in medicine, I have a master's degree, you're well educated from some of the best places in the world. But if you ask me right now to, in a very high pressure situation, to operate a ventilator, yes, you could understand the basics, and you do understand the basics, but just the technical aspects of it, respiratory medicine, critical care, ICU and ICUs, intensivists, these are fields that we've traditionally lagged behind in. And to suddenly say, okay, I need an ICU nurse to do this, it's very easy to say that, but in a real life situation, getting it done practically is a whole other thing. And so I think that aspect is sometimes lost in translation, because I think traditionally that's been an area where, and again, I know it's not a big buzzword thing. It's easier to portray numbers as far as, okay, this is how much of a stockpile we have. This is how much we need. And these things are really, really important. You need PPEs, all of these things. But at the end of the day, it's a human being who's taking care of you. And I think that is one of the things that I think is our biggest limitation at this point. And we kind of need to conserve the healthcare workers that we already have.
Like you mentioned, as the old adage goes, prevention is better than cure, and we might be able to import ventilators, we might be able to import oxygen tanks, but if unfortunately, if we lose a lot of our healthcare workers, that's irreplaceable. Not only the human cost or the human suffering to their families, but even in terms of what the state invests to make somebody a doctor, all the resources that they require. It's not going to be as simple as creating 3 million new doctors in a day. So right now, do you see our system? And I have a lot of appreciation for all the doctors who are working on the front line, or like you were working on the frontish line. It's phenomenal, and they've done a spectacular job at managing even where we stand right now. I feel a year ago, this might have seemed overwhelming as well. So the fact that, if the war analogy that you drew, the fort still stands, I think a lot of the credit goes to these people. Where do you see us right now? Do you feel the system is overwhelmed or is about to be overwhelmed? And with the government also announcing selective lockdowns and tracing a lot more and locking areas, do you think that's required to ensure that the system doesn't get overwhelmed?
So before I answer that question, I do want to clarify two things. First of all, when I say losing healthcare workers, I just don't not necessarily mean that, you know, they're affected and we're losing lives. Even when they're recovering, that is another loss to the front lines, right? So I know I'm again, one of the things you look at with my degree, with policy, with management, you realize that, you know, you're working with finite amount of resources, and you need to do the best job in the resources you have. So I wanted to clarify that front. And the other thing is, I know you mentioned doctors specifically, but I do feel like I need to point this out, so please forgive me for being nitpicky almost, is that it's not just doctors. You know, we're talking about nursing assistants, we're talking about nursing staff, we're talking about ICU nurses, paramedics. We are talking about a whole chain. So again, it's very easy to have a consultation with you know, a telemedicine consultation with an intensivist, but it is your ICU nursing staff at the end of the day who are still, you know, connecting you know, the patients to you know, the oxygen lines, who are the ones who are running the ventilators, your respiratory therapists who are doing all these jobs. So when I say healthcare workers, I'm lumping all of them in. And I think it's important to make that distinction also, because as the most frontline workers, I think there's a tendency we have, again, to forget. But answering your question, are we going to be overwhelmed? I think that's a very interesting question to ask, because I know from, I'm just going to step back for a second, is that I know I'm a little bit involved in this situation, right? And so my perspective is more like, okay, this is what the long term is, this is what our end goal is, this is where we are now, how do we get to this point, right? And the situation is changing and you're reacting to it. But if I zoom myself out of the equation and I look at it from the point of view of the average human being, you know, who woke up one day to find out that there was you know, a virus, you know, that originated in another species, it jumped over, it's a zoonotic virus, it's novel for the human beings. You know, they heard a lot of new things. They heard about an outbreak in Wuhan, and now they know that it's, you know, it's spread all over the world. Their life, everything has been affected. There's a lot of different mortality data coming in. The R naughts for the virus, the number of people that it is going to infect, was initially cited as a lower number, and now we've realized it's infecting a lot more people. Some of them are just asymptomatic, so we didn't know. You know, that
where is
they
it
had the
right now? I
virus.
believe 2.2 is what the number was initially.
I think so. Yes. Now it's much higher. It's almost double that, right? And
Wow.
so,
And for people who might not understand that the doubling of the R naught means it's exponential. So
it's exponential. A virus spreads exponentially anyway.
Yes.
So let's start with like the number 2. If like let's suppose that a virus has an R naught of 2, so it'll affect 2 more people, right? From the first individual. So if I have it and I'm patient 0 and I give it to 2 more people, they'll give it to 2 more people. So that's to the power 2. So
Yes.
that's 4. And then those 4 people are going to give it to, you know, 2 people each. So that's 4 is to the power 2. So that's 16. You get what I mean? So it just,
Yes.
it climbs up in that manner. So,
so even a 1, so if it's 4 instead of 2, that just means thousands of more cases.
Yeah, so the numbers rise up really quickly. And that's why if you see the curve, the pandemic preparedness curve, it goes up really quickly. And that's when you're on the logarithmic scale. And you see it's a parabola. It's not a linear, it's not a straight line that's going up. And the reason why we take a lot of these measures, we talk about social distancing, we talk about hand washing, use of PPEs, you know, masks. And again, going back to, you know, this whole thing is that what we're trying to do is reduce that spread. We don't want you to be able to infect the maximum number of people that you could. And I'll give you a classic example. And I know that there have been some COVID parties in Seattle that initially were, uh, again, these are single instances. Again, I'm not saying everybody is doing this, but, with people specifically going out in public events, knowing that they're positive, they're not going to infect 5 people. They're going to infect a lot more.
Yes.
And so the idea is that the number of people potentially infected gets higher, right? And so when you stay away from people, when you're social distancing, you're breaking the chain of infection, really. And so what you're effectively doing is reducing that number. And so the curve will look a little bit more linear rather than just going up, right? And so that's what the buzzword flattening the curve means, that we don't want it to go up on a logarithmic scale. And if we look at Pakistan, and if you look at, the way that the numbers have been rising, just again, not getting into, the nitty-gritties of it, but again, because we are currently just diagnosing cases. We're not screening for cases per se. And when I say per se, I mean the whole country, right? I'm not talking about specific instances. I know, for instance, certain healthcare systems have been screening, their patients, or like, for instance, their staff, and, community screenings have taken place. No one's denying that. But the thing is, on the whole, we're basically just confirming the diagnosis for people who we suspect, right? And so how that works out really is that the numbers that we're seeing, even with that, are close to linear. So what we're saying is that there's a potential, obviously, for it to rise further than this, right? And so we want to keep that spread, from one individual to the other as low as possible, because ultimately, if all of us get sick at the and it's the same thing as maybe like insurance, if all of us cash in on insurance at the same time, or any bank, they don't carry the, cash reserves for all of their customers at the same time, because there's an expected number of people that you can cater to. And so what we're trying to do is make sure that our healthcare systems remain within that limit. That we remain within the limit to what our healthcare systems are capable of catering. But that being said, I think it really depends, because the last thing that comes into play is that if we see, for instance, the way that the numbers have gone up, even before the lockdown was, taken down, and I understand that there's a lot of, basic fiscal measures and just basic responsibilities, because a lot of people, daily wages, especially in a country that's a lower middle income country like Pakistan, there are people who are not really routinely employed, who are, these are, working for daily wages. There are people who are, who don't have the kind of jobs that support, being able to work from home. And so we understand that that kind of is an extreme measure to take in a country like this. But that being said, even before that, you could see that, if individuals, if you and I, if we stop following the guidelines or best practices, and, I start shaking hands with everybody, I start rubbing my, I start playing with my beard, like, start itching here and there and shaking hands, I'm going to pass on something, or, like pick something up. So there's only 2 options.
I think even pre-corona, rubbing your anywhere, it was a problem. I don't think that's corona specific.
I think, the statement "Safai nisf iman hai," like, I know it's not just a statement, it's a hadith. And I mean, I'm not particularly religious, but I will say as much, that's the 50%, anybody, we are culturally prone to giving up. We're happy to like pray, we're happy to like, judge other people for not being religious. But when it comes to basic things like washing hands, staying clean, and, cleaning your house, and then not throwing the trash in the street, because that the net amount of, trash or cleanliness, it's kind of not really cleaning, is it? So I think we've had a lot of cultural issues to deal with, but then not just cultural, there are people who don't have running water. There are people who don't have, don't have basic wash, which is water and, sanitation and, and hygiene. Oh, they don't have these facilities. And so in a country like ours, it's sometimes easy to be, in Islamabad, in a nice house with air conditioning and running water and like generators, and just be like, pata nahi log baki kyun kar rahe hain. It's kind of like a almost a judgment statement at that point, because
Hmm.
in reality, can the average Pakistani, do they have access to these things in the way that is needed? If we look at Pakistan is the fifth most populous country in the world. Our population density, especially in urban areas, places like Karachi, Lahore, is quite high. You've got people sharing rooms, and so
Hmm.
it becomes somewhat impossible to socially distance. And if you look at our neighbors across, India, like right across the border at India, um, there's similar issues there, and for them and for us, social distancing might just be a middle class issue, right? Because you have your own space to be able to do so. And so in that sense, I really think it boils down to individual choices, because if all of us as individuals are sort of just realize that, okay, this is the worst case scenario, we don't want to go here, what are how low can we bring this down, and you say, okay, we say wash your hands frequently for 20 seconds. And I don't know if you ever washed your hands for 20 seconds. After
It's a
the
lot
first
of
10
time.
seconds, yeah,
After
after the
it's
first
only after Corona that I've realized that I had never washed my hands for 30 seconds before in my life.
So to be honest, one of the things I used to do when I was still practicing medicine is that, because you're supposed to scrub for 20 seconds after each patient, right? Or like at least hand sanitize, and if they're not visibly soiled, you can sanitize. But it's still a good practice to wash your hands, especially for 20 seconds, especially if you're a role model, and you have other people who are following you, and your practices. And so what I used to do is I used to talk to somebody, because otherwise those 20 seconds are long. It's like,
Yes.
like there's literally plank time, the time that you're doing a plank. And it, like, that 1 minute is the longest minute in the world. And then comes hand washing. It's so close,
Everybody
right?
just needs
And
to pick a song, I think.
I
I
mean,
think
you
CDC
have
recommended
suggestions,
two
go
happy
for it.
birthdays. Everybody pick a song that you know is 30 seconds and sing that every single time.
I mean, the thing is, it's hard. And so,
It,
just even for myself, I used to talk to somebody, because I would just be like, you're doing it, and then it starts to feel like a chore, and then you're wondering, like, it's hard. And the thing is, we're, as human beings, the
but
biggest
essential.
issue yeah, it's essential. It's essential. And the thing is, as human beings, we have to admit, all of us, like, I'm not exempt from this, is that we get bored really quickly.
Yes.
I can be the best, version of myself for like 20 minutes. It's really easy. But sustaining that over like the course of a week is hard. It is. And,
I
and,
think
and, and that's where things break down.
I think a really popular tweet recently was, I love how America just decided we're bored of Corona and decided we're not doing this anymore. We're done.
Uh, it's
We've
like,
done it for too long.
I'm
We're done.
done.
We're having a
I'm
good
done.
time anymore. So you've mentioned hand washing. Everybody's
Yeah.
now discussing masks as well. How important are masks, and are there any other recommendations apart from social distancing, hand washing, sanitizers?
Absolutely. So some of the basics I would say is just, um, you know, you, I can understand that everybody has different categories, but some of the basic things we all need to do is wash your hands frequently. And when I say frequently, if you have access to, like, I mean, I have an attached bathroom next to my bedroom, right? Or like this, I mean, I wish I had my own bathroom at work. That's something that, I think is on my wish list. I should talk to my boss about this. But
I hope they're watching this.
yeah, this is, it's very, very important. But um, 20 seconds frequently. The other thing is, the reason why we ask people to wear masks. I know this has been a controversial topic. I know it's been controversial in the US. There have been things, especially if you look at the WHO, their recommendations, they've been kind of shaky on it. But if you look at Asian countries in general, they've been kind of like, put on the mask. And I'll tell you, there's two big reasons for that. Is because we're a little bit more densely populated, you know, than maybe Western countries. And the other thing is that are if you have a younger population like we do, 64% of our population is under 30. That's a huge number. That's two-thirds. So, like, we are less likely to show symptoms immediately. And I'm not saying that you're not going to show symptoms. less likely, you're more likely to be an asymptomatic carrier, or, you're less likely to have more intense symptoms, sorry, from the get-go. And so you could have it without knowing, and you could be giving it to somebody. You could be giving it to your grandparents, to your parents. So it's always good to wear a mask because it's source control, right? And the same thing is for when you're out in public. The same is for everybody else, because this spreads mostly by droplet and by contact, right? So those are the two modes of spread. So droplets don't really generally don't go beyond like 1 meter, but 6 feet is a very safe distance, right? So in the US, they're recommending you maintain social distancing for about 6 feet. That's what the CDC recommends. The WHO recommends about 1 meter. 1 meter is basically, if you're about like 5'10", just stretch your arm out. And if you've got a little bit left beyond this, this is not a Nazi hell, by the way. I'm just sort of like, just a little bit beyond your arm stretch is a good ballpark, So the idea is that droplets will not usually make it to that point. But again, you put on a mask just to be sure. And if the other person is doing the same, what you're doing is protecting yourself from each other, right? And so those are really good measures to take. The other thing, which is probably the most important measure in the sense, because it's a good long-term habit to have, is social distancing. Literally as far away, I understand that certain hallways, certain places, you're not able to stay 6 feet away, and that's fine. Even if you're about a meter away, you've got a mask on, and so does the other person, you're generally going to be okay, because you can't eliminate the risk. I go out to work every day. I've not, if I've been sick for like 2 days, it was not COVID. But I'm a little bit upset about that because, at this point, you're just like, scary moment though.
At this point, probably the best people are who've recovered, because the hope is that antibodies are at work.
But the thing is, we can't, it's good to say that, but the other thing is that it's really hard though, right? Because you've recovered, but like for each individual, you're playing a probability scale. You're going to be okay 90% of the time. 5% of the time, you're going to run into a lot of trouble. And there's another 5% where you're going to run into a whole lot of trouble, right? So you're just playing, you're rolling the dice, right? And so I've not taken a single day off of work. For example, I go out, I buy groceries. You do end up interacting, because your staff has issues, you have to deal with people, and not everything can be done via Zoom. And so one of the things I've realized is that social distancing, just basic measures, right? Because we can't eliminate the risk. I certainly cannot. But what I can do is I can reduce it, right? And so what that means is that my likelihood of catching it still remains low. And I've actually done, I've had a couple of scares. I've had, I don't know why, but I had influenza, like all things, like non-seasonal flu at the worst possible time. And you can imagine that there was a lot of anxiety associated with a lot of the people that you're with. So I did get a PCR, it was negative. I'm having this conversation is because we kind of have to get rid of the stigma associated with testing also, right? Because at that point, if you were testing positive, people were really scared, they'd react really badly. And then about several weeks afterwards, I did get another seasonal sort of a cold. I did get tested again, this time serology. Again, thankfully negative. But, you kind of realize that these measures seem to be working, given the fact that, like, I guess I'm a good guinea pig, right? But the idea generally is that, like, if you minimize the risk, you're generally going to be in a relatively good place. But having said that, you can immediately tell the amount of privilege I have, right? Because I've had access to PCR since, very late March, start of April, right? I've had access to serology for like quite a while. So I know that I'm coming from a place of privilege when I say this, but what I'm trying to say is that you don't necessarily need the most high-end measures. You don't need to be walking around in a gown all the time. Basic measures, good idea. And one of the reasons why, have your sleeves rolled up, if you're going to work or anything, because you can wash your arms, like you can sanitize them, you can put on some hand sanitizers, rub it down. but you maybe are not going to be able to do that if you've got full sleeves and your sleeves are rubbing everywhere, right? And because there are reports, of the virus staying on contact surfaces for a longer amount of time, up to several days, some cases up to 9 days. Again, different studies cite different results. So it's a good idea to sanitize all the surfaces that you're in contact with, right? And so surface contamination, so the technical term for this is fomites. If you're going anywhere, the worst thing you can do is use a doorknob. Always push using either, the foot, like just push yourself on the door,
Kick it
use your
open.
shoulder, maybe kick it open. Depending on where you are and how hard you kick, that could be a good strategy. That could be a devastating strategy. But there are options. Just don't headbutt it, especially if it's a glass door. I would not recommend that. The idea is that,
I don't know, maybe that's safer than getting COVID for some people.
I mean, I don't know. Those are bad numbers. Those are bad numbers.
Or between a
I
rock
hope
and a
you're
hard
not a
place.
gambling man. I hope you're not a gambling man.
Well, let's play this game. All right, I'm going to give you scenarios. Give me from a very
Right,
low to a very high scale of chance of
right, right.
except getting takeaway food.
Right. So it depends, right? If you're getting takeaway food for from some place that's actually trying to follow some precautions, and they don't breathe on it last minute, just to give you the extra taste or whatever, or like if they wash their hands, it's a good idea. It's fine. But it depends though, really,
But you can't
because
digest it, right? Because I mean, if I read this right, it's not foodborne. So if you eat it, you're fine as long as you wash your hands.
so the thing is, yes and no. So it depends. So if I have dirty hands that I've contaminated, I have COVID, I sneezed on my hands. The other thing, sneezing, best to dab. I know it's not a popular thing. It's not cool, but hey, it's safe, right? But if you sneeze or somebody who's handling your food sneezes, um, yes, they might not touch the actual thing, but it's gonna, if you're going taking takeaway, like if you're having, to go meals, they're gonna put it in a box, they're gonna put it in a bag, they're gonna still touch that, and you're gonna touch that, and then you get what I mean. Even if your food might be scorching hot, you're gonna end up touching that bag, then you're gonna end up touching, that takeaway box, which is now like contaminated, and then you're gonna eat and then put it on your mouth, on any mucous membrane. So it can spread from mucous membranes, and mucous membranes are generally your conjunctiva, your respiratory tract. Your mouth has mucous membranes. So you get what I mean though, right? Don't touch things and put your hands in your mouth, for instance. That's a bad idea. And the same thing with takeaways, that if you're going somewhere who are taking necessary precautions, who've got gloves on, who've got masks on, they've got hairnets on, things that we might take, for instance, as part of our privilege package is normal or good standards. It doesn't apply to, maybe the Shami burger wala across the corner. But again, I guess that's where education comes in. We kind of have to update everybody on, okay, this was, cool maybe like 6 months ago, and we used to say this is where the taste comes from all the dirty, grimy hands. But it's not, we can't do this anymore, And so takeaway, I think, depending on where you are, could be safe, could be not.
You're
So
right. It's
it's
probably different standards, right? Because I was following Dr. Fauci, and Dr. Fauci said he gets takeaway in Washington every single night. And I'm like, well, probably takeaway is fine. But you're right. It really just depends on what standard they're following. I love Dr. Fauci. I've been listening to him very often. Your Fulbright in particular, you were telling me, works with the CDC, the Rollins School of Public Health, or is that established by the CDC itself?
So RSPH, we can shorten it, make our lives easier a little bit. We all call it RSPH.
My
Rollins
life
School of
easier. You
Public Health.
went there. You
Yeah,
have it. You have it
I
down.
mean,
I had to memorize it.
that's very kind of you, to be honest. We call it RSPH for the same reason, just an FYI. But so how the school came to be founded was via CDC personnel. It's very heavily, a lot of the CDC personnel do teach there. A lot of my professors are either former CDC or currently work at the CDC. And a lot of the standards that you work with are from there. And a lot of Rollins grads end up working with the CDC also, once they graduate. So it's a very nice feed forward thing. And I think it's a great way for the Centers of Disease Control to give back. in the most amazing way possible. And so, yeah, so I've had the pleasure of meeting, several CDC directors. I've had the, former, current. I've had the pleasure of meeting, uh, some of the US's most preeminent, public health professionals. I've had the pleasure of meeting some of the best policy professionals in the
Mm.
US, and I know this is why I continually say I'm coming from a place of privilege in this regard, and I'm really grateful to the Fulbright and to Rollins, for the opportunities and also for the training I received. Because if I'm being honest, um, and I laugh about this, sometimes, is that when you're taking disaster preparedness courses, where you're taking pandemic responses, you're taking talks, with the Zika virus, and this was around the 2015, 2016 time that you know I was in the US, and it was there for that point. And you're talking to some of the most preeminent professionals who are coming into Rollins or coming to Emory, and giving these talks, and you think, am I ever going to use this? Like, I'm sitting here like,
When will there ever be a global pandemic
say,
where I'll need to use all of this?
it's fine, we'll be fine. But and then right now you're thinking, okay, yeah, and the thing is, you kind of realize that a lot of us really, and I think this again, I don't want to generalize to all of Pakistan while doing so, is that it's not like we're not capable. It's just that we, for some reason, feel like, nah, khair hai, I'll be fine. Like, so when you have that mindset and you're not preparing, I think, and I think that's the case for a lot of us, because um, I've taken like a lot of WHO courses since this point. I've got myself certified by, the best practices that WHO is giving out. And while taking those courses, you kind of realize that, no, I already know all of this. And then you kind of realize that a lot of this is already being implemented. It's just that we've not really had a cohesive strategy. Or, like, people around you will tell you that, oh, you don't know anything. You're like, well, look at you, man. You're barely like half, like, professionals here continuously tell me is that, like, just because I'm not, on the north side of 50, I don't know anything. And so, that culture of self-doubt that you need to be XYZ years old to know anything, a lot of these things, and like, you have had to have had experience in the US or somewhere else to just have basic knowledge. I don't think that's fair, because I think a lot of us kind of just need to realize that we can do it, and I know this is like an impromptu pep talk I'm giving everybody. No one asked for this, but it's true, you know
No, I mean, you're right. It brings our conversation full circle as well when we're talking about doctors. A lot of the great work being done by them, and it's great that you got a chance to get the Fulbright experience and come back to Pakistan and impart some of the things that you might have learned. As capable and as knowledgeable a lot of our doctors are, they might not have had the same exposure. Like you're talking about
Agree.
privilege, it's the exposure that you got, that you were able to talk to people from CDC, to talk to people to World Health Organization, and bring that back. Even dealing with coronavirus, I think our doctors have done a fantastic job. Even plasma as one of the cures, I think we've done a really good job at that. Unless you think that's not
Shazad,
great.
I'm going to jump in here again and say healthcare workers, because it's not just the doctors who are doing it,
My
it's all
bad.
of us.
Uh,
I'm going to keep
assume I
correcting you
mean
till we
all
get it right.
healthcare workers when I say that.
Absolutely. You have to give props to everybody.
Yes. Just to end this with the news from yesterday, what's your take on dexamethasone? Is that the magical cure we were looking for?
So dexamethasone is a steroid. It is something that's so. I will take a step back from this whole thing again, just to be able to put it into context just a little bit. Is that if you look at the way that we've been somewhat like been pushed down into a situation, this has suddenly just been thrust upon us. We're there dealing with this. We're all looking for a magic bullet, right?
Mm.
And initially it was the vaccine. The vaccine is coming. Then somebody said, hydroxychloroquine has certain cardiac side effects,
Yeah.
and if you are already in a high risk population, it's throwing people in a high risk, those people who are in high risk into, adverse circumstances. And then the other thing that a lot of people say is like, nah, it works. Like, they give you circumstantial evidence, oh, I knew XYZ, or XYZ
Mhm.
gave it to their patient and they took it and they didn't get, and like, it's a lot of this is not like real evidence. You need like randomized control trials. You need to compare this drug to another drug. We can't do a placebo, obviously, because you have to give patients something in this context. And the other thing is the cocktails that we're generally giving. So what this virus does, some of the syndromes that it causes, because again, our immune systems have not seen this virus before, right? So the way that they react to it is different for everybody, right? Because my immune system is different from yours for several reasons, right? There are innate factors that are genetic, this is why, immunity, a lot of these things are inherited, but a lot of the way that your immune system does it develops in the environment also, right? For a lot of people, their immune systems don't hyperreact to this virus. So for them, they get milder symptoms sometimes. A lot of cases, you have more hyperreactive immune systems. You can have all the way up to cytokine storm or cytokine release syndrome, right? So in those cases, steroids sort of like curtail, like the whole situation, because basically the virus is in your body. Your immune system is just trying to gun everything down. I know these are like, I'm trying to just use sort of like
all I'm hearing is
allegories.
cautious optimism. Though maybe,
Yeah,
maybe there's hope.
I'm saying that steroids have a role in modulating the immune response, yes, but steroids themselves are not antivirals, right? So antivirals are the ones that are targeting specific, parts of the virus, right?
So definitely people at home, don't start taking it, and wash your hands, wear masks,
No,
and sanitize.
yes.
Is there anything I've missed out on in terms of the best advice?
I think also just, I think we also need to be a little bit patient. And I think we need to all sort of like, I want to say just huddle together, I guess, because it's a weird time. And I know I don't sound very professional saying this, so excuse that for a minute. But the idea is that, like we're all going through these really difficult stages, because I've been working. So I've been cribbing out the fact that like, I don't get a single moment off. I'm privileged also in certain ways, because there's people who've been stuck at home. There've been people who've been let go from, their jobs, and, financial impacts, and, and the financial and impact of this is still ongoing, and is going to mount up. So at this point, I think we kind of all have to realize that it's easy to say, oh, the US, this, that, or like India, this, that, or we all just, don't get along. And we've got a lot of that happening globally with a breakdown in leadership. And I think it boils down to us to sort of overcome it. So I think that would be the thing I would add.
The human will overcome it. I believe in
I
ourselves.
hope so. I hope
Thank
so.
you so
Because
much, Dr.
honestly,
Mekaiel Zia, for joining us. And thank you so much, everybody, for listening. Hopefully, we will beat this. And to everybody who's suffering, hope you feel better soon. Stay home, stay safe. Thank you. Take care.